Maternity question 4. 23. A pregnant woman in her second trimester calls the prenatal clinic nurse to report recent exposure to a client with rubella. Which of the following response by the nurse would be most appropriate and supportive to the woman? 1. There is no need to be concerned if you don't have fever or rash within the next 2 days. 2. Be sure to tell the doctor on your next prenatal visit, but there is a little risk in the second trimester. 3. You should avoid all school-age children during pregnancy. 4. You always call, I will check your rubella titer screening result and we can identify immediately whether future interventions are needed. The correct answer is 4. You were advised to call, I will check your rubella titer screening result and we can identify immediately whether future interventions are needed. 24. A maternity nurse is preparing to care for a pregnant client in labor who will be delivering twins. The nurse monitors fetal heart rate by placing the external fetal monitor. 1. Over the fetus that is most anterior to the mother abdomen. 2. Over the fetus that is most posterior to the mother's abdomen. 3. So that each fetal heart rate is monitored separately. 4. So that one fetus is monitored 15 minutes period followed by a 15 minutes fetal monitoring period for the second fetus. The correct answer is 3. So that each fetal heart rate is monitored separately. 25. A nurse is employed in fertility clinic. The physician sees a woman and her husband and her discuss the vitro fertilization with the couple. The couple asks the nurse about this procedure. The nurse plans the response based on which of the following accurate description of the procedure. 1. Ova and sperm are collected immediately and transferred into the woman's uterus. 2. A fertilized woman is transferred into the woman's uterus. 3. Ova and sperm must be obtained from the order other than the potential parent and it may take some time and located the donor. 4. Artificial insemination of sperm through the vagina with syringe is usually common. The correct answer is 2. A fertilized ovum is transferred into the woman's uterus. 26. A pregnant woman has a positive history of genital herpes but has not had lesions during this pregnancy. The nurse should provide which of the following information to the client. 1. You will be isolated from the newborn infant following delivery. 2. You will be evaluated at the time of delivery for hepatic genital tract lesion and if lesions are present, a cesarean delivery will be needed. 3. There is a little risk for newborn infant during this pregnant birth and following delivery. 4. Vaginal deliveries can reduce neonatal infection risk even if you have an active lesions of birth. The correct answer is 2. You will be evaluated at the time of delivery for hepatic genital tract lesions and lesions are present, cesarean delivery will be needed. 27. A nurse is in a delivery room assisting with the delivery of a newborn infant. After the delivery the newborn, the nurse assists in delivering placenta with observation would indicate that the placenta has separated from the uterine wall and is ready for delivery. 1. The umbilical cord shortness and length and changes in color. 2. A soft bulgy uterus. 3. Maternal complements of severe uterine cramping. 4. Change in the shape of the uterus. The correct answer is changes in the shape of the uterus.